Hi, everybody. It's Yvonne DeVita and Dr. Larry McDaniel with another session of Scratchings and Sniffings Out Loud. And today we're going to talk about a condition that dogs get, I believe it's mostly big dogs, called bloat. And Dr. Larry is going to talk a little bit about the symptoms and why it's very important to get your dog to the vet as soon as possible if you suspect it in your dog. So Dr. Larry, can you explain what it is and what we should be looking for?
Sure, Yvonne. Bloat is the common name for a disease that we refer to by a longer name, and that longer name is gastric dilatation and volvulus. And that name implies two things. First of all, bloat simply means that the stomach becomes distended. And what happens in many cases, especially with large breed dogs, that the stomach becoming distended is the first step in a process leading to the second part of that name, the volvulus part, where the stomach actually twists on itself. And so the gastric dilatation and volvulus is a two-part process. But bloat, the stomach distension, can occur by itself, and it can be something that happens without the twisting part. It can happen repeatedly in dogs without the twisting part, and then the twisting part can happen subsequently. So it's kind of a complex of things that we see in veterinary medicine. And it affects typically the big dogs, the big, deep-chested dogs. Think, German Shepherds, Doberman Pinschers, Great Danes, Irish Setters, and the crosses, the mixes between those breeds. And those are the ones that have deep chests. So they anatomically are more prone to this gastric distension and then the twisting. It's a medical emergency because when the stomach distends, there used to be a lot of thought about this is because stuff in the diet that's causing this. There are cereal grains, for instance, that are causing this. 10 or 15 years ago, soy. There are a lot of people that don't like soy in pet foods, I think for a lot of the wrong reasons. But people tried to say, well, this is fermenting soy, and that's what's causing this problem. There have been a number of studies that have been done over the years that have debunked all of that. It's really not a dietary thing at all. It's more of a conformation, meaning the shape and size of the dog, and a behavior. These dogs, not only do they have the big, deep chest, but they eat kind of aggressively. They eat their food. They kind of wolf it down. And then when they wolf it down, they swallow a lot of air along with the food. Mm-hmm. And those two things in combination seem to be the primary setup factors for this.
So if you suspect your big dog is in discomfort, what other symptoms should we be looking for that might alert us to this condition so we can get the dog to the vet?
If your dog's stomach does dilate like this, they're going to be very uncomfortable. And that's the first thing you're probably going to see. You're probably going to see some pacing, wandering around, looking very restless after the meal. They may attempt to vomit, but they're not able to vomit. They're going to be panting. And then this progresses because the stomach starts to put pressure on the big veins that go into the liver in particular, and then the veins that return blood to the lungs. So what happens is when the stomach distends enough and starts putting pressure on those veins, dogs can actually go into shock, the same type of shock that they would be in if they lost blood, for instance. So their heart is going to start to be affected, and they can collapse. And this can all happen simply through gastric dilatation. It doesn't necessarily have to be accompanied by the volvulus or the twisting part, but often it is. So what happens when you see this, your dog is going to be looking very odd and acting very sick. You're probably going to be thinking, I need to take the dog into the veterinarian. And if you have this deep-chested dog that eats like that, it's a good idea to keep this in mind as something that you need to get in to see the vet pretty quickly about. But what's going to happen is you'll go into the veterinarians and they'll try to pass a stomach tube and manually relieve some of the pressure that's built up in the stomach. If it's twisted, they might not be able to pass the stomach tube. And that's sometimes a sign for a lot of veterinarians that the stomach has twisted. And typically what they'll do is they'll x-ray, they'll see a big gas pocket in the stomach. They'll probably be able to palpate right behind the rib cage, there'll be a big swelling. You can see it. And when you do what's called percussion, or when you tap on the dog's abdomen, it'll sound like a drum, as tight as a drum, and it'll it's called tympany. So it's fairly easy based on the symptoms and the description of the owner and the type of dog to diagnose. And the therapy is immediate surgery, at the same time treatment for shock. So fluids, release the compression, corticosteroids to release the inflammation, and surgery to correct the problem. Usually the dog has to stay in the hospital for a while because the shock needs constant attention, at least for 24 to 48 hours.
And so what is the recovery period then? It sounds like the surgery then would go through the stomach area, the abdomen, get in there and untwist it. And what's the recovery period, and is there a chance that it would reoccur?
Well, it depends on how severe it is. Sometimes the twisting is severe enough that the blood supply to the stomach is interrupted. And if you interrupt the blood supply to the stomach for a significant period of time, hours, and the tissue is not receiving blood, that tissue can actually die. And that is, not all dogs with gastric dilatation and volvulus recover. The tissue's not been perfused by blood and dies, then a lot of those dogs don't end up making it, despite the fact that you've gone in and untwisted the stomach and relieved the pressure. So it is a disease where if it's not treated immediately or within a certain period of time, it can be fatal. And the shock, of course, can kill dogs as well. But it does tend to recur. Once it happens, things are loosened up, the ligaments are stretched, and it's more likely to happen again. And that's why when veterinarians do the surgery, they do something called a gastropexy, where they actually tack the stomach to the inside wall of the abdomen, so the stomach cannot twist on itself. It's tied down, adhered to the abdominal wall. And interestingly enough, we were just at a conference recently, the Veterinary Emergency and Critical Care Society conference in Phoenix. Mm-hmm. We were there with the Purina Care pet health insurance business just last week. And we spoke to a number of veterinarians that are involved in emergency and critical care. Mm-hmm. And they are advocating now as a routine procedure in big, deep-chested breeds of dogs, the ones that we've been talking about. They're advocating when you go in and spay these female dogs that you do the gastropexy when they're puppies. So it's so common that they recommend that you're spaying a Great Dane puppy at 4, 5, 6 months of age, that while you're in there, you tack that stomach down, that pylorus of the stomach, to the abdominal wall. So gastric dilatation and volvulus does not become a problem for these dogs.
Well, that certainly makes sense. And I hope that this discussion has alerted other big dog owners to watching and not accepting it as just the dog has a stomach ache and it will go away.
Yvonne, we did a post on this. If you look back through the Dr. Larry archives, I think it's called Gastric Dilatation and Volvulus.
I'm just glad that we got to get a little more detail and a little more instruction on it because, as you say, I did some research also and I got a little confused, and that's why I wanted to talk with you and really hear from someone I trusted what this is, how it happens, and what to do about it. So I really thank you for that. And
sure.
Hope this helps other people with big dogs because, as people who read the blog know, this is what happened to Carmel.
Yeah, we're so sorry to hear about that, Yvonne. You and I both know what it's like to have an older dog, and Darcy is not the type of dog that would get gastric dilatation and volvulus. She's too small, but she is. She's 18, and she's certainly not getting any younger, as we've talked about many times.
Yep, I know. So, Dr. Larry, thank you for your help today.
Okay, Yvonne. Talk to you soon.
Bye-bye.